Dyskinesia, on the other hand, is more a rhythmic contraction of large muscle groups. This woman is sort of showing a significant case of dyskinesia. So it's the rhythmic movement as opposed to the prolonged contraction which you see with dystonia. Okay. And actually, when you see Michael in interviews and you see that movement he has, that's another example of what dyskinesia looks like. Now, oftentimes we think of dyskinesia as being too much dopamine or too much medication. And we think of dystonia, because it happens often when our medications are low, as being not enough dopamine, not enough medication. But in fact, dystonia and dyskinesia can both occur when you have either not enough medication or too much medication. So not only knowing to tell your physician about when you're getting dystonia or that you have dystonia or dyskinesia, you also need to remember to tell them when you get it in relation to your medication. And as you can see, that will really help them discern whether you need to go up on a dose of medication or come down on one. It's really important. I guarantee you'll find a big difference in the way you feel if you're able to relay that appropriate information. So educating yourself, allowing yourself to become an active participant in your management really, really works. The other things you need to educate yourself about are your medications. Learn how they work. Learn how they interact. Do they interact with any of your other medications? Do they interact with things you might end up taking over the counter, for instance? These are all important pieces of information to know. Also educate yourself on the latest medical research. There's a lot going on. Now, sometimes it's very hard to discern, but there are some great websites, a couple of which I will mention in a moment, that will help kind of, decipher all the medical lingo and put things more in layman's terms for you. And that really is an important thing to do, because then you might want to, ask your movement disorder specialist whether that's relevant to your situation the next time you go in. Also educate yourself on the trials that are going on around you. I mean, I think the Parkinson's Society Canada website would be a great place to get that information. Because without the selfless hours and hours that the volunteers put into these studies, there's not going to be a cure, and there won't be any new treatments developed. So it's really important to become involved as much as possible. Where can you get educated? Well, obviously sessions that organizations like Parkinson's Society Canada put on are an excellent frame of reference for you to attend. There's also the internet, because I think that's where most of us get our information. And a word of caution. When I first started looking at resources on the internet, I had to weed through a significant amount of information before I could find anything that was reliable or relevant to my situation. So be very careful about what you read. Make sure that you go to really good websites. There's also a lot of snake oil salesmen out there trying to sell people, fast cures or better treatments. If it sounds too good to be true, it's because it is too good to be true. It's not. So please be careful of that. That having been said, there are many excellent resources available out there. And I'll just name a few. Obviously, Parkinson's Society of Canada is an excellent resource for local events, local in your community support groups, for patient education, research information. It's a great resource. The Michael J. Fox Foundation for Parkinson's Research is a really good place to get the latest information on the latest studies, for instance. They have a great section in there called In the News, I believe. It basically takes the most up-to-date studies that have just come out and puts it into layman's terms for you, explains the studies, taking out all the medical lingo. The Davis Finney Foundation. Davis Finney is a world-class cyclist now with Parkinson's, and he has a great website which is really devoted to living well with Parkinson's. A lot of practical information is on that website, with a heavy emphasis, obviously, on exercise, given his vocation. National Parkinson's Disease Foundation is a U.S. organization, but also a very good resource for general information. And the Brian Grant Foundation. Missy mentioned it earlier that I work with Brian Grant Foundation as an advisor for this new website that he's put forth called powerinforward.org. Brian Grant is a retired NBA player. I don't know if you have heard of him or not, but he's a retired NBA player who was diagnosed with young onset Parkinson's at the age of 36 back in 2009. And his website, powerinforward.org, is primarily devoted to newly diagnosed patients, their families and caregivers in terms of giving them information. It's constantly being updated and worked on. There's lots and lots of great information, a lot in video format, so it's a little bit more engaging, and something you should check out often, because there is, as I said, information being added. So Nassim, at this time I was going to say if we could just maybe take a few questions, and I can plug my family again. Great, so, okay. Take the question. Support team. For everyone, the members of the team may be different, depending on what your age and stage of life is. But in every case, remember that you are the head of that team, so definitely take charge. Now, before I go on to Parkinson's disease specifically, I have to put a plug in for the primary care physician. And I'm not just doing that because I am one. I'm doing this also because it actually is very relevant and important. You have to optimize your overall health. Just because you have Parkinson's, unfortunately, does not mean you're immune to other health issues, and I'm sure that there are people here that can attest to that. So keep up with your physical exams. Keep up with your routine blood work, with your mammograms or prostate exams, whatever the case may be. Because in order to live well with Parkinson's, you really need to optimize your health overall. Movement disorder specialist. Luckily, we live in Canada, and we do have access to universal health care. It might be a bit slow at times, but we do have access to it. Even more so, we live in a large urban center or surrounding areas, so we often will have access to movement disorder specialists specifically. People in remote areas don't always have the luxury of that, but luckily we do here. Regular visits to your movement disorder specialist are an absolute must. There are some fairly standard pieces of information that you should prepare before you go that will help you get through the sometimes short appointment with as much information taken care of as possible. Write it down, because when you're on the hot seat, you'll always forget something. You always have your hand on the doorknob, get ready to go and say, oh, I should mention that, I forgot to, maybe when you get home. So if you can prepare a lot of this information before you get there, that's even better. The information I'm talking about are, first of all, your standard motor symptoms. So tremor, any dyskinesias you might be having, dystonia, which we discussed, balance problems, freezing, and I'm not talking temperature, I'm talking gait. So sometimes people with Parkinson's will just stop and not be able to move forward without a visual or auditory cue. Swallowing difficulties and voice problems, which I mentioned I have. Also non-motor symptoms, depression and anxiety, apathy or difficulty initiating tasks, bladder problems, which I can speak to if you have any questions, he's a urologist, constipation, cognitive or memory problems, drooling, fatigue, loss of appetite, sleep problems, which is huge, and sexual dysfunction. These are all sort of the non-motor symptoms which your movement disorder specialist needs to know about. He or she also needs to know about on and off fluctuations. That's the period of time where things are working well and you can move well, versus periods of time when things are not working so well. And also medication. Know the name, dosage, number of pills, and number of times per day that you're taking your medication. Either write it down or take the bottles in with you. please, my pet peeve, please don't go in and say the yellow pill, the white pill, the round pill, please. Because there are many yellow pills, there are many white pills, and lots of round pills. And it depends on whether it's brand name versus generic. It becomes very complicated, and don't depend on your physician to have everything written down legibly, really. So it's best. I've seen decisions that have been made based on wrong information. I wouldn't want that to happen to anybody. So definitely take your pills in if you don't want to write them down. Okay. Now I have a confession to make on behalf of all physicians. Something that some of us will admit to and some of us may not. We are good at treating symptoms, but we don't always treat the whole patient. So it is a positive outcome if I make sure that I reduce your tremor. But is it actually a success if by reducing your tremor I give you other symptoms in terms of side effects? Is it a success if I reduce your tremor, but I don't pay attention to the other actually most bothersome symptom, maybe constipation, maybe depression, maybe anxiety? Is that a true success? I don't think it is. I think a success is improving a person's quality of life, improving their work relationships, their interpersonal relationships, their social life, the way they function on a daily basis. It's all about quality of life. And that varies from person to person. What may improve my quality of life may not be the same thing that improves yours. For instance, when I was working in urgent care, if I could get an extra 30 minutes of tremor-free time so I could take out the sutures or give a child an injection, I would put up with the side effects. That, for me, was improving my quality of life at work. But now that I'm off, I wouldn't necessarily do that, and I haven't done that. Maybe for someone else that doesn't work, it's more the depression issue that's affecting their social life, or constipation that, when resolved, would improve somebody's daily life. It's all about quality of life, and I think for that reason, what you need to also take to movement disorder specialists is information about that. What's your overall impression about how you are living? What's your quality of life? What aspects of your life does your Parkinson's affect? Daily living, occupational, recreational, interpersonal relationships. This is all very important if you want to live well with Parkinson's. And there are things that can be done, either medication-wise or counseling-wise. I mean, there are things that can be done to help improve your day-to-day existence. We talked about this briefly, friends and social circle. As I said before, we're not islands unto ourselves. We need our social circle. Don't ignore that aspect, and they can be valuable members of your support team. Either just to distract yourself from the stress that we face on a daily basis, or as a genuine support when you're having difficult times. As I mentioned before, I didn't tell my friends for a very long time, and afterwards, once I was able to disclose it to them, I had to accept it myself before I could get to that point. But once I did get to that point and disclose that information, a huge burden was lifted from me. I didn't have to go to social events and kind of contort my body anymore to try and hide my tremor, or have my husband, get my food from the buffet and cut my food up for me so that I didn't have to fumble with the fork and knife. That used to take a lot of energy, and a lot of time, and a lot of worry. And being free of that by disclosing it to my social circle has made a tremendous difference.